Hello, I'm Dr. Vanita Rattan, and today we have with us Dr. Ravina Bernard. So she specializes in women's health, and there are so many questions that we've been asked on this topic, and I wanted to really expand this channel and talk about other things that can benefit us. So today's video is a special one, and it is mistakes made when trying to conceive. And I can definitely say from my own personal experience with Sienna, so my first daughter, it was relatively easy to conceive, and I don't know whether it was because I was younger, but then it took a long time to conceive Josh, and I'd had a miscarriage before Josh as well. So it was, you know, I think when you're struggling to do something, you are trying to scavenge as much information as possible to figure out where it's going wrong. And that's why I think today's video is really important. And I wish I'd known some of the information previously. I think it would have probably saved a lot of heartache. So I hope that today's video will help you. So Dr. Ravina, the first question I think is, how are people supposed to know when they're ovulating?
Yes, okay. So this is actually a question I get asked quite a lot, especially in clinics when people are trying to conceive, and as you said, it can be a really long process for many people. But what I find is that many people don't actually know very much about their periods. They don't know about how often they're having their periods, and if you don't know how often you're having your periods and you don't know much about your cycles, then you don't know when you're ovulating. So my first tip would be to start tracking your periods, and there's loads of ways you can do this. So using, your calendar on your phone, or just using, there's lots of period tracking apps. So first of all, track your periods. Then the way that you work out your most fertile time, also known as your fertile window, is first you need to work out your ovulation date. Now your ovulation date, the way you work that out is you start from day one. So day one is the day you bleed. That's the day of your period. And you're going to minus 14 days from that. And that will be your ovulation date. And once you've got to your ovulation date, you're going to minus 5 days. And that's basically 5 days before the egg is going to be released. But we know between person to person, ovulation may happen a little bit sooner than we expect. So thereby, by having 5 days before ovulation and the ovulation date, you've got a good window when you have a good time to conceive. It is really important to make sure that you're having regular, unprotected sexual intercourse. Because you need to have it throughout the entire month, not just
the whole month.
The whole month. The whole month. And that comes on to another question that we'll come on to. But it's really important just to find out that you're ovulating and that you're having regular periods, so you can work out that fertile window.
I think one mistake that I made was that I would rely on these ovulation sticks, and actually later I realized I don't think they were particularly accurate, and I was only having intercourse when I thought I was ovulating. And I remember I was on holiday with my mum in India, and I was so sad because I'd done another pregnancy test and it was again negative, and I said, Mum, maybe I'm just too old. Maybe, my eggs have shriveled up, and maybe, I'm only ever supposed to have one child. And she just said, look, how often are you having sex? And I said, well, I'd pee on my stick, I'd look at the ovulation stick, and it'd tell me, okay, now this is the time. She's like, that's wrong. She said, you need to have sex for the whole month. And I was like, really, Mama? Because it's not that fun, it's very different to, when you first get married and it's all exciting. And then when you're doing, it feels like an exam where
it can get stressful.
Yes, we have to do the work now.
Of course. It is a really stressful time for couples. And it's really important to relax during the process and actually enjoy the process. Trying to conceive is one of the hardest things that couples will go through, and the hardest part is many people don't ever talk to anyone about it.
Really?
They keep it, it's such a
taboo subject.
It's a taboo topic.
Even now.
People think that, there's a blame culture. If you can't conceive, then whose fault is it? Is it the woman? And in many cases,
does it tend to be
in many cases, women are blamed, but actually,
that's what I was thinking.
There's two people in this situation,
Correct,
and of course, men play a very important part in producing sperm. And we can go on to how important quality of sperm and quantity of sperm is. But remember, there's two people involved, and we do need to make sure that we're educating both sides of the population.
Yeah, absolutely. Yeah, no, I think that's completely correct. I don't know why the blame lands on females, as if it's a one woman show. It really, like this, it really isn't. So yeah, I completely agree with you. Okay, so we touched on how often you should be having sexual intercourse, but can you go into a little bit more detail?
Yes. Okay. So there is a common misconception that people should be having sexual intercourse every single day. Now, we shouldn't be doing this. The average is around 3 to 4 times a week.
Okay.
Now, with eggs, female eggs, they're released from the ovaries, and this happens once a month, and generally it's from either side of the ovary. And now the egg actually only lasts between 12 to 24 hours in the body, in the female body. Sperm, however, lasts up to 5 days.
Wow.
So we need to have the sperm ready to fertilize the egg. So as soon as the egg's released, you have a good window for the sperm to be swimming about, capture the egg, fertilize it so it can be embedded into the womb.
Right.
So we need to make sure there's a good amount and it's there often, but not all the time.
Okay.
And the reason for that comes on to our next point, and that is, should we be having sex every day? And the reason why you shouldn't be is because sperm needs time to, we need enough sperm, and we need good enough quality sperm. Now, the testicles is where we produce, men produce the sperm. So if you're having sex every day, you're releasing a lot of sperm, men are releasing a lot of sperm, and we need more time to regenerate that sperm, called spermatogenesis. If we have a low quality and low quantity of sperm, then that can have implications on the pregnancy, because they won't be as healthy, and there's lower chance of getting a viable pregnancy, because you're having sex but you're not actually having enough semen that's in the female reproductive system, therefore there's less chance of the egg being fertilized. So we need to make sure that not only are you having sex regularly, but you've got enough time to regenerate the sperm.
That's a really good question. So you're basically creating a welcome party. The sperm is the welcome party for the princess egg to come along. So I think the next question is, I don't know, are there any positions you can do, or anything you can do to keep it?
Oh my God.
We're trying to create a welcome party.
So I get asked this so often. So like, are there certain sex positions that you should be in? Should I be having my legs up in the air?
Oh, I did that. I saw that in Friends, and I was like, it can't hurt.
So there's actually such little evidence on it's actually working, despite
bed rest. You just do like bed rest.
We see it on Friends, we see it on TV, we see it in all these sitcoms, but actually when you look into the evidence in all the medical literature, there's no real evidence to suggest that.
Has there ever been a clinical study on this though?
There has been.
Really?
There has been. But we know that sperm enters the female reproductive system so quickly that, putting your legs in the air isn't really going to have that much benefit. And they swim. They're very strong swimmers. Sperm. If you have good quality sperm.
Can they swim out?
No, so
all directions.
So actually, the sperm are fast swimmers, but the female reproductive system is even more intelligent because we produce, of course, females are. And the reason why is because we produce certain hormones, and these allow secretions and cervical mucus to be produced that actually accelerate the sperm into the womb. And so we have all these sort of chemicals like prostaglandins, and we really produce a lovely environment for the sperm to be welcomed into the womb. And it's these kind of factors that encourage the sperm to go forward. It's not really positions that are going to affect it. It's our hormones, and it's our productions and secretions in it with female bodies, as well as the secretions in the male fluid that help it to be propelled towards the egg.
So this was the other thing that I read was at the time it could be potentially having not enough secretions or a dry environment that doesn't allow sperm to reach. And so I remember even using a lubricant which was meant to be pro-conceiving, that created a better environment for sperm to reach the egg. How much evidence is there on this? Is it worth it? Is it worth trying it? Is there any downside to it? What is your thoughts on it?
Lubricant. So the purpose of lubricant is to allow sexual intercourse to be a lot more pleasurable. It's to stop pain, especially when people have dry vaginas. So driving, you've got less secretions. But this is acting in the vaginal canal rather than the womb. So you have a vaginal canal, you then have a cervix, and then you have your womb. So when a couple have sexual intercourse, the sperm is already past the vaginal canal, and it's actually already it's hit the cervix, you're already in the womb. Your lubricant isn't going to be hitting the womb. You know, even if you were to feel your vaginal canal, which we do encourage women to do, especially if you've got coils and things, you can actually insert your fingers and feel your vaginal canal. It's that environment that needs the lubricant in order to allow it to have reduced friction, in order for sexual intercourse to be more pleasurable, and to just ensure that the whole environment is a lot more comfortable, but that has very little implication on the sperm because it's further upstream.
Really good information. I think one other thing is, for me, was like, when do you go and see a fertility specialist? At what point do you start thinking, you know, this isn't normal and it should be easier than this? What's your take on that?
Yeah, no, that's a good question. So in the UK, the first port of call for any medical issue is your GP. Okay, so it's your GP that can make that further referral into the fertility clinic to the specialist, whether that's the gynecologist or whether it's a male factor issue where you'll need to see a urologist. But as a couple, you would be referred together to the fertility clinic. Now, there's being referred too soon and there's being referred too late. So we'll talk about too soon first. Now, most couples under the age of 35, if you have regular unprotected sexual intercourse, so that's, you know, as we discussed, 3 to 4 times a week for the whole year, then it's expected that you will conceive, and 80 to 90% of couples will conceive within a year. And that's under the age of 35.
Right.
And now within 2 years of regular unprotected sexual intercourse, more than 90% of couples will conceive in that time. Okay. Now, if you're over 35, so, you know, in sort of, we call it increased maternal age. So there are complications with being older and being pregnant to not only mother, but also to your baby. Now, if you fall in that older category, we'd like to expedite the process quicker. And that's because your chances of a successful conception is less. So if you're having regular unprotected sexual intercourse for about 6 months, then talk to your doctor, because we want to make sure, you know, there's nothing underlying, you've got a good ovarian reserve, you've got, you know, a good lifestyle, so you're optimizing your chances. And if all of those things are fine, then perhaps we need to think about if we need to do some internal investigations, and then we'd think about a fertility referral quicker. So just to be very aware that you need to be having sexual intercourse regularly, and also if you've got anything underlying, talk to your doctor about it, because you might need to have some further tests beforehand.
I think this is such a sensitive topic, and a very difficult one, especially for females who work. So I can only talk from my own personal experience, but I think if you're in a job or, you know, whatever you're working on, it takes so long to be successful in that career that you've been working at your whole life. You know, you do your GCSEs, you do your A levels, you do your degree, and then you're on the right path, and you're toe to toe with your male counterpart, and you're thinking, how do I? At what point do I say, okay, I'm going to stop this and I'm going to go and do this, which basically can railroad and detract what's going on with your career? And it's such a difficult question to answer, you know, when you should even start trying to conceive. You know, does it start at 30? Do you start 33, 35, 40? Like, what is the right balance for you? So, you know, for those women who are 35 plus and, you know, they've been focusing on other things, and now they're thinking, okay, you know, 37, 38, you know, 40. What is the best thought process for them? Should they, at what point do you start harvesting eggs? At what point do you start thinking about freezing eggs? When do you ever start thinking about surrogacy? Like, how do all these other options come into play, really?
Is, you know what, you've hit the nail on the head, because as we are going into this new generation of women, you know, we are excelling in our careers. Many women are climbing up the career ladder, and actually children aren't seen to be the biggest priority as perhaps they were a whole generation ago. And that's something that I'm working on at the moment with Zonas Fertility. And it's really important for us to educate the female population as well as the male population on egg count. We know as women get older, their egg count drops. And we think it's important for people to know about this, because there's things called premature menopause, when women are going into menopause earlier than the average age, and it means they can't have children. And it's absolutely life. It's just so what do you call it, just so upsetting to see other women going through such a difficult time, and it's because they didn't know that they had underlying issues, that their mother had premature menopause, that they hadn't checked their egg count. And I would suggest, you know, if it is something that is worrying you, or if you have a family history of it, then it is worth checking it. But of course, you know, in terms of when you should start to conceive, there's no magic number, there's no magic age, because each family, each woman, each situation is so individualized. It depends on so many factors. But it is important to keep it in the back of your mind, because no matter what, we can all succeed in our career, but fertility doesn't wait for anyone.
I know.
As you get older, the chances get harder, and it's not just you have to think about the baby. The chance of chromosomal abnormality is huge. At age 40, the risk of Down syndrome, also known as trisomy 21, is about 1 in 100.
Okay.
And that's a lot.
It's a big jump.
Yeah. So there's lots of things to consider. And as with all women, it's always such a juggling act. It's such a balancing act between, you know, advancing with the career and the children. And actually, most women want to have everything. So it is about, you know, a balance.
I know. I completely feel the pain. I remember even when I was pregnant, I was lecturing. I was on my feet teaching, and I didn't take any time off. Like literally fully pregnant until right at the end, and then I had my babies, and then I went back to work after 2 weeks because I didn't have a choice. You know, you have to do what you have to do for your family, but. It was extremely difficult. I do feel like women have to work twice as hard. I feel like if you want to have children and you want to have a successful career, you have to work twice as hard as any male, because the amount of pain your body goes through and the amount of trauma that you're dealing with simultaneously with trying to succeed in another area of your life is not something any man will ever understand. I remember my husband just saying, "I'm so glad I'm not a woman."
It's actually our mission to educate not only couples, but actually corporations, because we need to get this into the workplace. We need to be talking about fertility and how important it is for women to be engaged with their career, but also have a family. And as you said, women do have to work harder, because you have to balance both things. And so if we can educate, you know, the top banks and, you know, even the smaller companies that actually we need to support our women so that they can have it all, then, you know, we're on a winner. We need to support half the population who are conceiving.
I know, but I think the only way to do that is to sell it to the companies as why you want females who are mothers in your corporation. How is this going to add value to you? And I think personally, anyone who's gone through, you know, having children, I think it was the hardest thing I ever did, like bar nothing. I think everything I've ever done was easier than having children. So just the sheer work ethic of a mother is something that, you know, very few men are going to be able to compete with. And plus, I think their perspective is different. And I think diversity of perspective is essential. It's a reason for, you know, having the banking crisis, and, you know, any major fall of any empire has happened because of lack of diversity and lack of information from other perspectives.
And there's so much research on that, right? So there's so much research on if you have a diverse workforce and if you have a lot of inclusion in your workforce, you have a diverse skill set, you have new perspectives, new opinions, and that actually advances businesses, it advances any organization, any team. So we know there's so much evidence on that, and that's why companies need to be supporting women, because they bring new perspectives, and it's not just, you know, a male-dominated society anymore. We're way past that. So yes, you're completely right, and we do need to be encouraging our women to have the best of both worlds. 100%.
Agreed. I think a really good topic that we focused on, we touched on before, was your egg count. How I never did my egg count. I didn't even know it was a thing. This is also not the type of stuff that you learn at medical school. This is a type of stuff that tends to happen after that, and so I think it's something that we should talk about, is how do you figure out your egg count? Like, is it a difficult process? What do you need to do that?
So that just leads nicely on to what we're launching at the moment, which is known as Fertility. So at medical school, you're completely right, I didn't even learn about this, and we learn about, you know, we have to do certain hormonal tests. We need to look at our estrogen, our progesterone, our LH, FSH. And FSH is something that does look at your follicle stimulating hormones. That looks at how your follicles are doing, if we're stimulating enough in the ovaries. Now, what we're doing at Zonas is looking at another hormone, which is the anti-Müllerian hormone. And that tells us, basically, AMH hormone is released from the ovaries. And that tells us how many, and if we've got a good quantity of eggs left in the ovaries. Okay. So we provide a home blood test, and you do it at home. You don't need to tell anyone. It's obviously quite a sensitive and personal topic, so you don't need to tell anyone. We send it to your home. It's a blood test that you do. We only need a few drops of blood. You send it to us, and then we provide you a personalised fertility report. And that tells you about, you know, if you're likely to go into premature menopause, early menopause, if you have a good sort of success rate of IVF, and also what the implications you have on your pregnancy. So it's a super easy test. And it's something that will tell you right now, it's a snapshot in time of how many eggs, and if you have a good quantity of eggs right now. Now, this is something you can repeat every 3 months, every 6 months, every year, and you can see that decline over time. As women get older, their egg count drops. At age 30, women have less than 10% of their egg count left.
At what time? At what age?
30.
At 30, they have
less than 10% of all the eggs they're ever born with are left.
At 30?
At age 30.
So do you think, so you know how we always say 30 is sort of like, you know, where you start to see a drop in your fertility. Would you say there's a drastic drop at 30 or 35? Where is it? I think it keeps changing the information.
Yeah, so it depends on so many factors. So like lifestyle factors, the more we eat, the more we drink, the more we smoke, that's going to just kill all of our eggs. So there's so many different factors that affect when your egg count will drop. But we know that as you get older, it's a trend, it's a downward trend. Okay, and that depends on your lifestyle factors, if you've got underlying ovarian issues, if you've had an STI and you've got pelvic inflammatory disease. There's so many different issues that will affect your ovaries. So that's why, depending on your individual situation, you can get your eggs checked, see, actually, you know what, my egg count's perhaps a little bit lower. Perhaps I need to be thinking about pregnancy sooner, so I can plan my life around that. But I think it's important to stress that there are so many variables that affect fertility. It's not just the women, as I said. Ovarian issues make up 25% of fertility issues.
Only 25%?
25%.
Wow.
And then male issues make up about 25%, so sperm issues. And then you have tubal issues. Those are problems with your tubes, your fallopian tubes, and they're 25%. And the other 25% are unknown, and they're unexplained causes of infertility that we don't know. Doctors don't know. There's so much research going on in the space, and there's more and more evidence every day. But many couples will never have a clear reason as to why they can't have children. But what we can do is deal with the things we do know. So we need to deal with the 75% of issues that can cause infertility.
That's quite interesting. You talked about smoking and alcohol. How detrimental is smoking and alcohol on ovaries and eggs? And sperm as well?
Loads. This is a big topic, and I've done a whole video on it on my channel. So basically,
make sure you follow.
I've actually just done. I've had so many comments about how does obesity lead to infertility. So I've got a whole video on it. But actually, it's because obesity, it's to do with our hormones. So you have an increased hormone called leptin, and that can interfere with some of our androgens, which are our sex hormones. And so that has an effect on our estrogen and progesterone, which throws off periods and means that we can't track our ovulation, and it means we aren't ovulating regularly. But it's a huge topic, and I don't think I can give it justice by just saying a quick answer now. That's a really huge topic.
All right, excellent. That's so helpful, actually. I think we've taken enough time. Do you know what? If there are any other videos you want me to make with Dr. Vanita Rattan, please can you write them down below, because I think today's been really helpful, and I do actually want to do a whole series on women's health. I think a large percentage of us here today are female, and so we are all going through similar issues, but I think sometimes we don't talk about things as openly. So we'd love to do a whole series for you, so please do write down below videos you want me to make for us to make together. But thank you so much for watching. Please do like, subscribe, and please do also follow Dr. Ravina too, and we'll see you next time. Take care.